Without oxygen being passed from the lungs to the bloodstream, then pumped around the body by the heart, you will die. When a person suffers a cardiac arrest, their heart may not beat properly or may stop beating altogether. In this case, blood will not effectively circulate around the body. They will lose consciousness and stop breathing. Unless prompt first aid attention is received, they will suffer irreparable brain damage and may die within minutes. In this program, we demonstrate the technique that should be employed in performing cardiopulmonary resuscitation on an adult. We are therefore assuming that you have a general knowledge of first aid principles. CPR is a technique that can save lives when performed correctly. Simply put, CPR is the technique of applying chest compressions in conjunction with rescue breathing. CPR involves pressing down and releasing firmly on the sternum or centre of the chest hard enough to squash the heart, forcing blood out into the circulatory system and then back through the heart. This, combined with breathing into the casualty's airway, usually the mouth, can supply much needed oxygen to the lungs and the circulating blood. Performing effective CPR is the only way a rescuer can ensure oxygen-rich blood is circulated through the body, keeping the organs alive. The air we breathe in contains about 21% oxygen, and the air we breathe out contains about 16 to 18% oxygen. Therefore, breathing into a casualty's airway can supply potentially life-saving oxygen to the casualty. Before commencing CPR, the following basic life support steps must always be applied. Check for and continually monitor dangers to the rescuer, other personnel and the casualty. Check for a response by talking to and firmly touching the casualty. Raise an alarm and call for an ambulance straight away. Check that the casualty's airway is clear. Look for signs of an obstructed airway, for example vomit, blood or other obstructions. Look, listen and feel to determine if the casualty is breathing normally. If the casualty is breathing normally, place them in the recovery position. Wait for medical attention to arrive and monitor their condition regularly. If the casualty is unresponsive and not breathing normally, you should immediately commence CPR. Let's look at the technique that should be employed by a rescuer when performing CPR. For demonstration purposes, we will use this mannequin. First, you should kneel alongside the casualty in a position that will allow you to comfortably apply vertical pressure during compressions. Next, visualize where the center of the casualty's chest is. Then, place the heel of one hand on that point in the center of the chest. This achieves our aim of placing the heel of one hand on the sternum above the heart. Keep that hand in position and place the heel of the other hand on top of the first hand and interlock the fingers of the hands like this. Alternatively, you can grasp around the wrist of the first hand like this. Either method is acceptable. Be sure not to apply any pressure over the casualty's ribs, abdomen or the bottom end of their sternum, as this can cause damage to internal organs. When performing compressions, you should pivot from the hips. That is, you should not be rocking back and forth. Position yourself so that you are directly above the casualty's chest. Your compressing arm should be kept straight. Your bottom hand should remain in contact with the casualty's chest, and your shoulder will be directly above the chest when compressions are delivered. This ensures effective compressions by utilizing your upper body weight. Compressions should be rhythmic, with equal time for compression and relaxation. and you should allow the chest to recoil completely after each compression. With an adult casualty, each compression should depress the chest at least 5 centimeters, or about 1/3 of the depth of the chest. Compression should be delivered at a rate of 100 to 120 compressions per minute. This means almost 2 compressions every second. After every 30 chest compressions are given, 2 rescue breaths should be delivered. This is how you deliver rescue breaths. Make sure the casualty's head is fully tilted back. Place the palm of one hand on top of the casualty's head. Support the chin with the other hand and firmly and gently tilt the head back while supporting the jaw. This will help maintain an open airway. Take a normal breath. Open your mouth and place it firmly over the casualty's mouth, creating an airtight seal. Pinch the casualty's nose closed. Alternatively, you can seal the nose with your cheek. Breathe firmly enough into the casualty's mouth to make the chest rise normally, fully inflating the lungs. Each rescue breath should be delivered over 1 second. After each rescue breath, remove your mouth and turn your head to observe the chest fall, and to listen and feel for exhaled air from the casualty. If this does not happen, it must be addressed immediately. The cause could be an inadequate air seal of the mouth and/or nose of the casualty, an insufficient amount of air being blown into the casualty's lungs, or it could be an obstruction in the airway. An obstructed airway is generally caused by incorrect or insufficient head tilt, ineffective support for the jaw, the tongue itself, or foreign material could be in the mouth or airway. The airway should be cleared using standard first aid procedures. Let's look at the cycle of compressions and rescue breaths. Give 30 chest compressions, followed by 2 rescue breaths at a rate of 100 to 120 compressions per minute. Be sure to monitor the casualty for signs of response or normal breathing, but don't let this interrupt the rate of chest compressions. If the casualty responds or starts breathing normally, stop CPR immediately. If the casualty is not breathing, CPR should be continued until signs of life return or until qualified medical help arrives and takes over. Those main points again. Apply pressure directly over the center of the casualty's chest and depress to a depth of at least 5 centimeters or to about 1/3 of the depth of the chest. Apply 30 compressions and 2 rescue breaths at a rate of 100 to 120 compressions per minute. Be sure the airway is clear before giving breaths. The head should be fully tilted back to keep the airway open, and the nose should be sealed off. Watch for the rise and fall of the chest. Inadequate air seals around the nose and mouth and airway obstructions must be quickly remedied. And monitor the casualty for signs of response or normal breathing. Let's now look at a simulation of what you would do if you actually found an unconscious person. First, check the area for any immediate danger. Check to see if the casualty responds to talk or touch. Ask the casualty to open their eyes. Squeeze my hand. Let it go. If the casualty does not respond, raise an alarm and call an ambulance as quickly as possible. Then, check that the casualty's airway is clear. If the airway is obstructed with foreign material, roll the casualty onto their side to help clear it away. Only when the airway is obstructed by foreign material such as blood or vomit should the casualty be placed on their side. At all other times, they should remain on their back so CPR can be given promptly if required. To turn a casualty on their side into the recovery position, use the standard first aid procedure. Using your fingers in a brushing motion, start clearing the casualty's airway. Once the airway is clear, check for breathing. Look, listen and feel for any exhaled air from the casualty and see if the chest is moving. If the casualty is unresponsive and not breathing normally, place them on their back and commence CPR immediately. To continue our CPR stimulation, our rescuer will work on our mannequin. Position yourself comfortably. Visualize the center of the casualty's chest. Position your hands and give 30 compressions, making sure your compression arm is straight. Your shoulder is above the casualty's chest and each compression is at least 5 centimeters deep. After 30 compressions, give the casualty 2 rescue breaths. Counting aloud may help you keep track and regulate the process that you must apply rhythmically. Keep giving compressions at a rate of 100 to 120 per minute. CPR should be continued until the casualty responds or begins breathing normally, or until qualified medical help arrives and takes over. If available, an automated external defibrillator or AED should be attached to the casualty as soon as possible. A large number of emergencies that require CPR occur as a result of sudden cardiac arrest, which usually leaves the heart fibrillating or quivering. Studies show that a casualty's chances of survival increase substantially the sooner defibrillation can occur. An automated external defibrillator or AED is comprised of a central unit and 2 pads. It is designed to deliver an electric shock to the casualty in an attempt to stop heart fibrillation and restore normal heart rhythm so effective blood circulation can occur. As a rescuer, you do not have to evaluate the casualty or deliver the shock. When attached to a casualty, the defibrillator can detect a fibrillating heart and will advise when to deliver a shock if it is required. The defibrillator will instruct you verbally, step by step, using easy-to-follow voice prompts. If the defibrillator detects the return of a normal heart rhythm, the voice prompt will advise you what to do next. It is important to note that a defibrillator does not replace CPR. CPR must be continued at all times unless the defibrillator tells you otherwise. It's understandable that being placed in a real situation where your actions could save a person's life may lead to confusion and panic. But always remember what you're aiming to achieve with cardiopulmonary resuscitation. You are trying as best you can to simulate the body's natural functions of breathing and circulating blood with a normal beating heart. Completing 30 compressions and 2 rescue breaths at a rate of 100 to 120 compressions a minute is the best you can hope to achieve in your attempt to save a life. If you are unwilling or unable to give rescue breaths, chest compressions should still be applied at a continuous rate of 100 to 120 compressions per minute. If you're in a situation where 2 people are able and capable of performing CPR, exactly the same principles apply as when performing CPR with 1 rescuer. 30 compressions, followed by 2 rescue breaths at a rate of 100 to 120 compressions per minute. When there are 2 rescuers, one should start resuscitation while the other seeks help and calls an ambulance. Rescuers can then take turns performing CPR and should rotate when necessary to reduce fatigue. Make sure that pauses in chest compressions are as short as possible when changing rescuers. Every workplace should be prepared for emergencies that require CPR and should take precautions to ensure the protection of people's health and hygiene in the event of such an emergency. Products like gloves, masks and shields to prevent direct mouth-to-mouth contact or contact with body fluids should be part of your first aid kit. Everyone should consider how they would react to protect their own health and safety if faced with an emergency situation. Products like these enable you to take appropriate steps if necessary. Let's check the basic life support and CPR principles again. Check for and continually monitor dangers to the rescuer, other personnel and the casualty. Check for a response by talking to and firmly touching the casualty. Raise an alarm and call for an ambulance immediately if required. Check that the casualty's airway is clear. Look for signs of an obstructed airway, for example vomit, blood or other obstructions. Look, listen and feel by placing your hand on the casualty's chest, placing your ear near the casualty's mouth and or nose and feeling for movement to determine if the casualty is breathing normally. If the casualty is still not breathing normally, you should commence CPR. Give 30 chest compressions, followed by 2 rescue breaths at a rate of 100 to 120 compressions per minute, and check for a response or normal breathing. If available, attach an automated external defibrillator to the casualty as soon as possible and follow the voice prompts. Keep performing CPR until qualified medical help arrives or until signs of life return. Remember, CPR can save lives.